Hello, I'm Nathan Wymer, Chair of the Board of Trustees for the Alcohol, Drug, and Mental Health Board of Franklin County. Welcome to our second annual virtual ADAMH annual meeting. We look forward to the day when we can meet again in person, but for health and safety reasons, we decided it was important to host our annual meeting online again this year. Together, we continue to adjust to a new normal. Throughout all the changes and challenges of the past 2 years, ADAMH's provider agencies have continued to go above and beyond to ensure people have the mental health and addiction resources they need. Thank you to our 30-plus provider agencies who truly provide the safety net for our community. Their work is more vital than ever as the pandemic has increased the needs of Franklin County residents. Later in the program, you will hear about some of our award recipients who have gone above and beyond to meet some of these critical needs in our community. I would also like to recognize my fellow board members for their leadership and commitment to helping ADAMH set the course for the next 5 years. Over the past year, our trustees have helped to engage the ADAMH staff, provider staff, and the community in an organizational assessment, a community needs assessment, and a strategic planning process. ADAMH CEO Erika Clark Jones will share about the priorities we developed throughout the strategic planning process. I want to share our new vision moving forward. All individuals and families in Franklin County can achieve optimal mental health and wellness, free from stigma with equitable access to quality community-based services and supports. One way to realize this is through collaboration with other leaders who share a commitment to a better community. Leaders like our newest member of the Franklin County Board of Commissioners, Erika Crawley. We are proud to have Commissioner Crawley serving in Franklin County, bringing her experience as a mother, a veteran, a former member of the Ohio House of Representatives, and a mental health advocate. Thank you for joining us, Commissioner Crawley. We are grateful for your willingness to share your personal perspectives on mental health.
Hello, and welcome to ADAMH's 2021 annual meeting. I'm County Commissioner Erika Crawley. First, I want to thank you all for the work you do every single day for our community by connecting residents with the resources they need, providing treatment, or by working to make our mental health and addiction service system more equitable. Our community is lucky to have you all working in it. As you all know, America is struggling with mental health and substance abuse issues. Before the pandemic, about 20% of Americans were suffering from mental illness, and over 18% of adults with a mental illness are experiencing a co-occurring substance use disorder. We know these numbers have increased due to the hardships of the COVID-19 pandemic. Our own community members are struggling with mental health and substance use disorders. Here in Franklin County, there were 855 reported overdose deaths just last year alone, an 84% increase from just 3 years ago. As our county coroner says, we're experiencing an epidemic within a pandemic. And as all of you know well, the rates of mental illness and substance use disorder don't often tell the whole story. Too often, the people from most marginalized communities who need high quality mental health care are the ones least likely to have access to it. People of color, children, members of the LGBTQ community, and other marginalized groups. They are less likely to be diagnosed and receive treatment that they need. But we're not succeeding as a community if we're leaving some of our neighbors behind, and that goes for mental health care as much as it does for income and economic mobility. 60% of youth with major depression are not receiving any treatment for it. Rates of suicidal ideation are also highest among young people, and especially the LGBTQ youth. And the rate of suicide attempts by Black adolescents has increased more than 70% in the last 25 years. I'm sure that many of you who work in this space know these statistics far better than I do. They're not new, and they're mostly not specific to Franklin County. Our challenge now, though, is what are we going to do about it? I don't know all the answers, but I was asked to share my vision for how we can be more resilient community with more equitable access to mental health and addiction services. We cannot continue to be a county where one's life outcomes, things like health, wealth, and life expectancy, can all be predicted by what zip code you grew up in, the color of your skin, or whether your parents were immigrants. We also need to break the mental health stigma that lowers people's self-esteem, hurts their relationships, and reduces their chances for success in treatment. For these reasons, I'm going to make and continue to make mental health care one of the topics I talk about when I'm in the community speaking as a county commissioner. I have struggled with depression and anxiety myself. I've been open about it. My mother and my father struggle with addiction and have 20 years in recovery. And once I have opened up about my story, I realized that many of our friends, families, neighbors, and other community members have also shared their struggles. We know that talking openly about these issues can help reduce the stigma, and we know that there are some corners of our community that could certainly use more honest talk about them. Behavioral health, mental health, suicide, and addiction are collective issues. We can't let them be taboo topics or pretend that they don't even affect all of us. Further, we need to address other societal issues too, outside of purely the healthcare field. When people do not have security, be it housing, food, familial, or economic, it adds mental strain. In this way, policymakers' decisions affect an individual's day-to-day well-being. My main role as a county commissioner is to improve our social safety net. By providing support, we can help people get to a place where they can take care of themselves and their mental health and addiction challenges. I have personally experienced how governmental assistance has been crucial to helping me during difficult times. This is why I want to work on addressing the societal and social determinants of health, including housing issues. Likewise, community leaders, especially our elected officials, need to be more mindful of the messages that they're putting out to the public and the implications of policies they're enacting. In the state budget, a provision was slipped in that will allow healthcare providers to deny care if it is against their personal beliefs. We are fearful that this will allow discrimination against the LGBTQIA community and our friends, as well as add barriers to reproductive health care. Patients should feel safe in the places that they're accessing healthcare and not fearful of healthcare professionals' biases. For this reason, we also need to work to recruit more young people, people of color, and LGBTQIA practitioners to the field so that they understand and can work on an industry that looks more like the communities who are most impacted. Thank you all again for the important work that you do in this space and every day. And thank you for allowing me to share my thoughts about these important issues. I look forward to working with you closely over the years to come to help strengthen our behavioral health care systems and ensure it is equitable for all of our neighbors in Franklin County so everyone has the opportunity to thrive and not just survive.
I'm honored to present each of our 4 ADAMH annual awards this year, beginning with the Extraordinary Mile Award. This year, we are excited to honor the COVID Care Team of Franklin County with funds from the FEMA-funded Ohio's COVID Care Program in collaboration with ADAMH and the Ohio Department of Mental Health and Addiction Services. 3 of our agencies developed outreach teams to connect individuals and families impacted by the pandemic with free financial, food, housing, and health services. National Church Residents, Community for New Direction, and Ethiopian Tewahedo Social Services partnered on these efforts. The teams provided more than 10,000 crisis counseling sessions, 13,000 education support contacts, 3,000 groups counseling and public education sessions. A multicultural marketing campaign accompanied the programs to promote the services to communities of color, New American, and older adults. The outreach teams helped get needed supplies along with PPE when families were quarantined to their homes with a COVID diagnosis. They helped families with language barriers connect to food and housing services. They ensured students had access to the technology needed to participate in online school. And they helped families avoid eviction by connecting them with rent assistance programs. Please join me in thanking the COVID care teams of National Church Residents, ETSS, and CND for their extraordinary efforts to connect our neighbors in need with critical resources.
Hi, I'm Gail Stone, the COVID-19 Resource Specialist Supervisor at Community for New Direction. Meet my amazing team. This is
Jamia Shepherd.
This is
Rhoda Cancal.
Thank you to the ADAMH Board for the Extraordinary Mile Award. Remember to
Wear your mask. Use hand sanitizer.
and social distance. Thank you and stay safe.
I'm Denise Martin, CCP Supervisor. On behalf of our amazing team, Claver, Bardos, Navy, and Ramallah, we'd like to thank ADAMH for this award. We'd also like to thank ADAMH, Ohio Moss, FEMA, and SAMHSA for trusting us to provide culturally and linguistically appropriate services. Thank you.
Asante sana.
Mahasane.
Gracias.
धन्यवाद.
Good evening. My name is Teresa Lauderdale.
Hi, I'm Wilhelmina Spinner, and it was my honor and privilege to serve as the project manager for the COVID care team of Franklin County. On behalf of National Church Residences, we would like to thank the ADAMH Board for recognizing us as an Extraordinary Mile recipient and providing services to seniors, African Americans, and families in the community during this pandemic. Thank you.
The next award is named in honor of the late Barry Mastrine, who was dedicated to community service and improving the lives of people affected by mental illness and addiction, inspiring countless others to follow in his footsteps. Our Barry Mastrine Award honoree Lynn James, Chief Operating Officer at Alvis, has demonstrated outstanding leadership, blending compassion, innovation, knowledge, and hard work to get the best out of her team. She rolls up her sleeves to do whatever is needed, including pulling double duty as a case manager in one of the residential reentry treatment programs. Linda has developed a healthy work culture by supporting the development and well-being of all Alvis staff. She's continued to expand services, including transitioning to telehealth during the pandemic, adding certified recovery housing to 3 locations in Columbus for women and their children, and working to add recovery housing for men this fall. She's accomplished this all while staying focused on providing the best possible services for individuals and their families. Congratulations to Linda James. We are humbled by your dedication to your staff and your service to our community, and are honored to present you with the 2021 Barry Mastrine Award.
I am honored to be selected for the Barry Mastrine Award. I'm so grateful to be part of the human service community here in Central Ohio. Together, we're making both the county and the city much more healthy and more resilient. At Alvis, I have the privilege every day of helping to turn people's lives around. We serve people and families with issues related to substance use disorder, mental health issues, and traumatic life experiences. I have a favorite quote, and it says that one of the most important things that people can do on this earth is to make sure nobody feels alone. I work with a tireless and dedicated team of professionals at Alvis who go to any lengths to ensure individuals who walk through our doors at any time know that they are never alone. It's a team that just doesn't give up. I sincerely thank the ADAMH Board for selecting me for this prestigious award, and I also thank Alvis CEO and President Denise Robinson for nominating me. I am truly, truly humbled, and thank you so much.
The Art Lynn Consumer and Family Advocate Award is named on behalf of Dr. Art Lynn Jr. As a longtime Board of Trustees member of ADAMH and a cherished advocate in our community, this year's recipient is an ideal example of what this award represents. Juliet Doris Williams is an Executive Director of the Peer Center, a drop-in wellness recovery and support center for individuals living with mental illness and addiction managed by people with lived experience. And that includes Juliet, who works to ensure that the voices of those living with mental illness and addictions and their families are included when planning for mental health and addiction services. Throughout the development of the new Franklin County Mental Health and Addiction Crisis Center, Juliet has worked to ensure patient and family satisfaction is a key metric used to evaluate the Crisis Center is meeting its mission, and that families and those with lived experience are represented on the Crisis Center Advisory Council. Not surprising, Juliet's advice goes beyond Franklin County. She's a member of Ohio Governor Mike DeWine's Recovery Ohio Council and is a leading advocate on behalf of the peer recovery organization across the state of Ohio. It is with great pleasure that I present Juliet Doris Williams with the 2021 Art Lynn Consumer and Family Advocate Award.
Hi, Juliet Doris Williams here. First, I want to take this opportunity to thank Jeff Klinger from the Central Ohio Hospital Council for nominating me for the Art Lynn Award. Jeff and I don't know each other outside of a single point in time where I participated in a work group that he was facilitating related to our new crisis center. From that time, I remember being highly vocal that peers be afforded the same autonomy, the same level of clinical respect to be able to act in their scope of practice. My intention in that space was to insist that peers be considered full and valued members of this effort, not just token slot fillers. As one living with depression and anxiety and as a survivor of trauma, I know too well the hills and valleys my community has to climb and travel through to be fully accepted as worthy contributors and valued members of society. I know the discrimination and judgment we often have to navigate in a world that first sees us as sick people, forever relegated to the status of patient. And while there are many in our community that will need lifelong patient care and ongoing support, that should not be the single standard for all of us. No human, no community of like-minded, like-skilled, like-affected should be weighed by a single standard. Do not think you know us by that single story of what we were like, what our lives were like when we were at our lowest point. I am grateful that my story, because of this honor and because of this recognition, now includes how I have contributed to the dignity, well-being, and self-sufficiency of the people in my community. Thank you, ADAMH Board of Franklin County. Thanks again, Jeff. Peace and blessings. Stay safe and well, everyone.
Our last recognition is a new award and one that will have special meaning to many of you. The award celebrates and honors the work that Dr. Kevin Dixon, former Vice President for Community and Cultural Engagement, championed during his 34 years of service to ADAMH. His work focused on improving diversity, equity, and inclusion throughout Franklin County and within the ADAMH system of care. The Kevin Dixon Champion of Diversity Award is just one way to demonstrate to Dr. Dixon and to our community that advancing accessible, cultural appropriate services will continue to be one of the highest priorities for ADAMH. It is my honor to present this award to Dwayne Casares, CEO in Directions for Youth and Families. Dwayne has spent the last 3 decades integrating diversity, equity, and inclusion into all aspects of the agency. He developed a diverse and inclusive workforce that reflects the community in which he serves by investing in cultural competencies. He built interpretation services and ongoing cultural competency training into the annual budget. He developed programs and services that truly address the changing needs of the community, such as a Youth Pride program, which provides individuals and family counseling services to youth that identify as LGBTQ. And the expansion of the Crittenden community on the east side to include a women's center offering gender response program to help women who have faced trauma. The best way to describe why Dwayne is receiving this award comes from his nominator, Jennifer Van Scoyk. There is no one more deserving of the Kevin Dixon Champion of Diversity Award than Dwayne Casares. He absolutely embodies this. Dwayne is a visionary and a leader. He has the imagination and the wisdom to develop unique solutions and has the passion, leadership skills, and charisma to move ideas forward. Congratulations to Dwayne Casares, recipient of the first ever Kevin Dixon Champion of Diversity Award.
It's a true honor to be the first recipient of the Dr. Kevin Dixon Diversity Champion Award. You know, I've known Kevin my entire career, and those of you who know him know what just an outstanding, awesome guy he is. So I'm really grateful to be the recipient of this. At our agency, when I first came here 30 years ago, our staff did not match the population we serve. So we started a minorities issue committee, and it was geared towards a recruitment, hiring, retention of people of color. That eventually became our cultural committee, and today our Evolving Together committee, which is grounded in listening, empathizing, learning, and growing from each other. We believe strongly in these values. We believe strongly in social justice, and we think these things are married together. So diversity, equity, and inclusion is paramount, and particularly for the people that we serve. So all of us, I believe it's our duty to be champions of this, but we are grateful for this honor. Thank you.
Hello, I'm Erika Clark Jones, CEO for the Alcohol, Drug, and Mental Health Board of Franklin County. Thank you for joining us for our 2021 annual meeting and our second virtual gathering for this occasion. Congratulations to this year's award recipients. I'm honored to recognize your service. And thank you to the dozens of ADAMH providers for your continued resolve to manage and adapt to changing circumstances. This past year has been one of resilience, yet also one of opportunity. The demand for accessible behavioral health care is strong, and the providers that fuel the ADAMH network of care continue to respond. For example, the Peer Center's Warm Line proved to be such an invaluable resource during the pandemic that the center recently expanded their capacity to ensure that persons with lived experience are available to support community members during these times of great need. To help combat opioid overdose deaths, more than 5,000 additional doses of naloxone were distributed in Franklin County's hardest hit zip codes in partnership with 8 ADAMH provider agencies, including North Community Counseling Centers, Comp Drug, Ohio Guidestone, Columbus Public Health, Community for New Direction, Mary Haven, and Southeast Healthcare. The Buckeye Ranch launched an LGBTQ+ anti-stigma campaign, including resources for LGBTQ+ youth, family and caregivers, educators, and allies. To address the need for additional capacity for substance use disorder treatment and transitional support for individuals with justice involvement, Alvis recently broke ground on a $25 million expansion at the existing Alum Creek facility. This year has also been one of recommitment to our mission, our community, to the people served by the ADAMH network, and to the more than 30 community-based providers who make up the ADAMH system of care. Franklin County ADAMH has a renewed and expanded investment in our network, thanks to you, with the passage of a 5-year countywide property tax levy. Coupled with the increased community behavioral health care needs intensified by the pandemic, there is no better time to redefine our path forward. ADAMH is grateful for the significant support for our community-based behavioral health safety net. This support comes with responsibility to ensure that ADAMH remains a good steward of taxpayer dollars. Nearly 70% of our 2020 budget was funded through levy dollars. These funds support vital mental health and addiction services and supports delivered through a network of more than 30 community-based provider partners. As our board chair, Nathan Wymer, mentioned, we have spent much of the last year looking at how ADAMH can better deliver on its mission. Through organizational and county community assessments, we identified many opportunities to enhance the network and its 6 systems of care. Informed by that input, we have a strategic roadmap for the next 5 years to align with the new levy cycle. As a network, we are at our best for our community when we hold ourselves accountable to common outcomes and proven measures of success. This means working with each of our partners to monitor and achieve high standards that result in lower suicides and reduced overdose deaths in Franklin County. Our data supports ADAMH's focus on equity and access across our behavioral health system, and we will accomplish this through innovation and collaboration. Some of the most visible work in service delivery over the next year will be our efforts to enhance the continuum of crisis care. Mental health crises are health issues, and whenever possible, should be responded to by behavioral health professionals when there is no threat to safety or a medical emergency. We continue to work with public safety and community partners who agree that this approach should be guided by delivering the most appropriate response for an individual situation. Most importantly, we want to understand and support providers' needs so that they successfully serve our clients across all 6 systems of care. Our network is only as strong as each provider's ability to attract and retain a qualified, diverse workforce. There is an additional opportunity for ADAMH to provide more direct support in this area. to enhance the pipeline of behavioral health professionals as well as help providers keep their talented employees. Among the strategies we are exploring is funding assistance for securing and attaining professional certifications. ADAMH will also look at ways to address the competition for talent. Finally, as we recommit to being good stewards of public dollars, we must understand and measure the impact of our investments in a new way. To answer the questions, how much did we do? How well did we do it? And are clients better off as a result? For this, data is critical. Better data collection, analysis, and reporting of local ADAMH investments, including who we serve and who we are missing, must be known. This information will be a powerful tool in helping us fund more of what is working, improve what is not working as planned, and identify opportunities where there are gaps. Because at our core, our business is about helping people thrive. As the largest ADAMH board in Ohio, we are uniquely positioned to lead the way to increasing accessible, equitable, community-based mental health and addiction services and supports. There is power in the ADAMH network. To the more than 30 agencies, all working towards common goals to improve mental health and addiction outcomes in Franklin County, thank you. Together, we are ADAMH, where better begins for so many of our neighbors and friends. Thank you for joining us.